A very good evening and many thanks for joining us on the Health Show. So today we'll be talking matters of oral health, and with us in the studio is Dr.Tim Theuri, who's a dental surgeon. Many thanks for joining us on this production. Tim, thank you very much for joining us and gracing our studios today.
Thank you so much for having me. Asante sana.
Asante. So who's Tim Theuri?
I'm a dental surgeon based in Kilimani. I have a practice there. I am a dental surgeon by training, profession and calling. So it's something I love doing, and I am happy to be here and give information to everyone, to the MWANDU, and to anyone else who may need our help. We are happy to help. Yes.
So what does it take to be a dental surgeon? Maybe to somebody who's watching us and wants to become a dentist.
I think for a start you have to have it in you. Like I said, for me, I always wanted to be where I am, and I don't take it for granted. I thank God for giving me an enabling environment, and more so for the endurance to go through school. So for anyone to go through the course, the cutoff points are a bit high. Once in a while, the cutoff is above the one for medicine, that is from KCSE. And right now the curriculum is changing for some of the universities. University of Nairobi is moving from the four-year course. There's a change over to the 5-year course, and I think the first lot is going to graduate next year. I schooled at Moi University, and for us it was just straight 5 years, and it was a fantastic experience. I think among the best years that I've had, I can trace them back to when I was training to be a dental surgeon. Yes.
So why is it essential for us to take care of our teeth?
Why is it essential is because how I look at it is we are not treating a mouth in a patient, or we are not treating the oral cavity in isolation. We are treating a patient who has a mouth, right? So by that, what I mean is things that are happening within the mouth are not happening in isolation. They are not happening on their own. They are happening because of other things within the body, our lifestyle and things like those. Because through the mouth is where the body is getting nourishment. Right? It's among the channels through which we take things in our body. Besides the eyes and the ears and our nose, the mouth is the other route through which things come into our body. And if you look at the size of it, it's quite big, so it means it's essential. Yes. So we need to take care of our mouth for that reason. Yeah.
And then what leads to discoloration of teeth? Because I've seen many people with the tinted teeth. So what leads to that?
Ideally, teeth are supposed to be what we call white, and the different types of whites. So we love milk white, we love paper white. All those are types of white, and teeth may not exactly mimic the white that we think they should have, but generally they should be white. Any form of discoloration that is happening is either what we call intrinsic within the tooth itself, all right? That is during development, disturbances that do happen, things that we do take, all right? Things like fluoride, especially, that is the biggest culprit for this.
For discoloration?
For discoloration. Fluoride is a mineral that is in various types of foods that we take, and more so in water. And the reason why we treat our water, besides eradicating microorganisms and bacteria that cause other diseases, is to ensure that the mineral content, that is the sodium, the fluoride, the potassium, magnesium, and all these other minerals, are in the right quantities, all right? Because anything that is taken in excess is dangerous. It's dangerous.
Because I guess to think that the likes of toothpaste, they're made of fluoride. So I don't know what quantities and everything you're talking about.
Fluoride in toothpaste is among the components, and how I will put it is I will briefly describe what fluoride does, and from the discoloration point of view is the moment you take too much fluoride than what is recommended by WHO and our local bodies, CABs and county governments. What happens is these fluoride levels are very high in your body. So the effect is 1 on teeth, which we can see, and 2 on our bones, that is skeletal. So that is what we call skeletal fluorosis. Dental fluorosis is what we see in teeth, ranging from and has different levels of severity, from mild, moderate to severe. In mild, we'll have spots of chalky white teeth. Moderate, a bit of discoloration, some brown lining, and then very severe, where we have heavy brown teeth, heavy browning of the teeth, teeth that are chipping. And what happens in a person who has fluorosis, their teeth are very brittle, meaning they chip away very easily, and this predisposes them to dental issues, cavities, and caries, as we call them. So what is in toothpaste is what is topical. That is, it is not being swallowed. You don't swallow toothpaste.
Yeah,
you don't swallow toothpaste. So what happens is, as you brush your teeth, the fluoride in the toothpaste, what it does is the bacteria that are responsible for some of the dental decay that you experience, fluoride affects how they work. And since they are affected in how they work, they are killed off. And from that, they cannot subsequently cause fluorosis. So that is dental decay, sorry. So that's why it is important to have fluoride in toothpaste. And of note is the levels of fluoride in toothpaste are a bit high for that function only. But whatever we are taking has to be very, very low. I think it should be about 1 or less than 1 parts per million. Toothpaste has about anywhere from 900 to all the way to 1400 parts per million. So if you have to do those two comparisons, it shows in toothpaste it's high, but what you're supposed to take is very low. How do you go about it? What you're supposed to do is ensure that the water you take, you can ascertain the fluoride levels. Okay, and how do you ascertain fluoride levels? The bodies, that is the local water bodies, that the organizations that provide water to our people are the ones that are supposed to ensure that the fluoride levels and other minerals and the water that we have is safe to drink. So normal council water that is provided by our county governments should ideally be safe, because they are the ones who are to ensure our safety. Over and above that, even areas where you're using borehole water, or areas where
because I tend to think borehole water is salty.
Is salty, and the saltiness in borehole water is in there are areas you go where the saltiness is not so much, others is so bad. It's because of the difference in the mineral content of the borehole water. And more often than not, as borehole water will have high fluoride levels. So in areas like Nakuru, Naivasha, Baringo, Mombasa, right now in Athi River, Kitengela, where we're having people living off borehole water, we are seeing increased cases of fluorosis. What can be done is, like as we're explaining, ensure that what you're taking has good fluoride levels, the correct fluoride levels. If you can afford bottled water for drinking and cooking, is what you're supposed to do. For drinking and cooking, because this is what you're taking. On the high end. It's on the high end. I mean, but we are taking care of our teeth. Boiling does not exactly mean that you're taking away the fluoride content. Boiling of water. But it's essential. It's essential to ensure that you are not predisposed to other diseases like cholera and typhoid and things like those. But for our case, where we are talking about fluoride, it doesn't exactly mean that it is you'll get correct fluoride levels after boiling. So since we are dealing with a common humanity, since we are dealing with someone who is in the village, since we are dealing with someone who is out there, they cannot afford bottled water. They may not exactly be in a position to go somewhere and buy water, yet they are fighting to take their kids through school, to do other things with their money. So it is, I think the onus is on our national government and the county governments to ensure that our people are given good drinking water, and the moment that is done, then it opens avenues for also other good things to happen to our people. Yes.
How about those people with fluorosis? Can the fluorosis be dealt away with?
Yes, there are various modalities for treating fluorosis. One is preventing, and by preventing is ensuring that as soon as mothers are attending their pregnancy clinics, they are given a brief, or they are told how to go about taking care of the teeth of this child who's yet to be born. All right, and that is ensuring that they're given the correct type of water and how to brush this child's teeth, what to do when this child is born, all right? Ensuring that this child is not sleeping with a feeding bottle, they're not sleeping when breastfeeding.
What happens when a baby sleeps with a feeding bottle?
What happens is there's a tendency to try and sweeten the water in the feeding bottle, and as soon as this child begins getting teeth, they're sleeping with sweetened water, which is basically sugar, and this accelerates the process of dental decay happening, and that is why it is discouraged. So how do they go about preventing, the discoloration? We first prevent it from happening, ensuring that we are drinking the right amount of the right type of water. 2, depending on the severity, like I had explained, from mild to moderate to severe, there are various ways of going about it. Once in a while, bleaching will help.
Bleaching the teeth?
Bleaching the teeth, in-office bleaching of teeth. And that is an area again where dentists are facing a challenge, because we have all sorts of people saying that they do dental bleaching, yet they are not practitioners of dentistry. Okay. According to CAP 253 of the Medical Practitioners and Dentists Board, there are people who are licensed to practice dentistry. And it does help to know that the place you're visiting, this is a practitioner who's enabled by the law to practice dentistry.
So for one to practice dentistry, they have to be registered?
They have to be registered by the medical practitioners and dentist board. That is a requirement, and anyone who's practicing dentistry without the authority of this board is doing so in the wrong manner. Back to our issue. Before
we get back to the issue, we're just taking a short break, and with that, after the short break, we'll continue the discourse.
All right, fantastic.
Okay.
Yeah.
For joining us on the second session. Supposed to joining us for the first time, with me in the studio is Dr.Tim Theuri, who is also a dentist by profession. And today we are talking matters oral health. What do you need to know about oral health? Theuri, as we continue, how often should one go for a dental checkup?
What is being recommended now is twice a year. That is every 6 months you should visit your dentist. And what was being done before was once a year. But what we realized is the life that we are leading right now, the lifestyle that we are leading, we have a lot of foods that we're taking, a lot of processed foods, and in these processed foods we have increased sugar content, sweeteners and things like those, sodas, juice for children. The foods you're basically taking have a lot of carbohydrate content, and out of this we realize the incidence and the prevalence of dental disease is going up. So the reduced period, we had to reduce the period to twice a year, every 6 months, to improve disease surveillance, to check up things before they happen, because they're always indicators of things that are happening that are leading towards certain bad diseases. So we need to arrest them before they do happen. So that is recommended.
Because the main reason why I'm asking this, because many people, they tend to think that only if my tooth aches is when I can go see a dentist.
Right.
So I think that's essential, the way you say it.
Yeah, I mean, you don't wait for your car to get bad so that you can take it to the mechanic.
You have to take precautions.
Yeah, you have to take precautions. You have to do routine service. You change the oil, you change something here and there. It's the same for the human body and more so the mouth. Visit a dentist every 6 months, and that goes for everyone in the house, from the children to the parents to everyone in the house. They should at least keep the 6 months checkups, just to be given a clean bill of health, or just to be told that we are seeing, hey, something ABCD is going to happen, so we need to do XYZ to prevent the outcomes of these bad events. Yes.
I want us to talk about tooth sensitivity. First of all, what's tooth sensitivity?
Tooth sensitivity, I'd say, is something happening to the mouth. You either take something hot or cold. It could be a drink, could be food, could be some form of mild trauma, a jab maybe, or referral, and the effects of that on the teeth are interpreted as sensitivity. So the tooth, when something offensive happens to it, is interpreted as sensitivity, and if it's so severe, subsequently as pain. Yes.
And then what causes the tooth sensitivity?
Tooth sensitivity is caused by a stimulus happening, a stimulus on the tooth, hot changes in temperature happening, or when you have exposure of the tooth, that is the hard covering surface of the tooth, that is the enamel, probably chips away, and the inner soft parts of the tooth are exposed. And since this is what, within the tooth we have a chamber and spaces within the tooth that contain small blood vessels, connective tissue, nerve endings, and other cells that help the tooth heal itself. And these nerve endings within the tooth are the ones that will receive the stimulus or receive the changes in temperature, send the signal to the brain, and the brain will interpret it as sensitivity. So that is what I would describe as tooth sensitivity in the simplest terms. Yeah.
Do you guys do, as dentists in Kenya, do you normally do the dental x-rays? And if so, why should somebody do a dental x-ray?
Yes, it is being done in Kenya, and very advanced ones for that matter, in various towns, Nairobi, Kisumu, Nakuru. And the reason is, this is where dentists are concentrated. As a shocker, I think we are only about 1,400 dentists in the country.
Really? Okay.
Since the first dentist was registered by the board, we are about 1,400, and I think we're even less than that because not all of them are in clinical practice. Some may have passed on and things like those. So the number is slightly less, and is even to even shock, I think less than 500 are working for the governments. That is the national government and the county government. So the situation is dire. We're at about one dentist for every 42,000 Kenyans, and we submit the recommended 1,000 for every one for every 7,000 Kenyans. So dental X-rays are being done, and very advanced ones for that matter. When they should be done is at the discretion of the dentist to help him in coming up with the right diagnosis, to help him come up or help her come up with what is actually the real cause of what it is experiencing, whether it is pain, whether it is a swelling, whether it is bleeding, or things like age assessment, and all those things.
Even tooth goes with age?
Yeah, I mean, they grow at different, all the way from when you're born.
Yeah.
They are the tooth within the jaw, much as you cannot see it, it's developing, and when you take a dental x-ray, you can see the stage at which the development is occurring, and you can be able to say that this person looks to be around 5 years. According to 5 years, but that's according to the that's called the dental age.
Okay.
We do have people who their dental age is ahead of the real age, or a bit less than their real
What
age.
leads to that?
I mean, it's just the body,
Okay.
the different types of people we do have. So yes, dental x-rays are being done. Dentists decide when they are being done, when they can be taken. Since it's exposure to x-rays, you don't want x-rays on you every other time. There has to be a strict guideline as to why it is being done, and the benefits of this x-ray must outweigh the risk that the exposure causes.
How about the affordability?
They are pretty much affordable. Our national centers, Kenyatta National Hospital and these other hospitals, county governments have really made tremendous efforts in supplying of dental x-ray equipment, and we must commend them for that, for those who have made efforts in that direction. Yes.
Another question that leads me to this: how often should we change our toothbrush?
Yeah, you go to places, you visit places, and you see people with toothbrushes that almost resemble a shoe brush that has been used for a very long time. You're supposed to change your toothbrush every 3 months. That is 4 times a year. But as soon as the bristles of the toothbrush, that is whatever is used to brush, have started fraying, that is bending, and some of them facing the direction that you did not buy them facing. So as soon as that happens, ensure you change your toothbrush.
How about if you don't change?
What you don't, if you don't change, what happens is a toothbrush is a tool, and if it is not in the right condition, then it means that it is not working effectively. So that is what happens. It will not be effective when you're brushing. How many times again are you supposed to brush your teeth?
Yes, how many times in a day?
Given the society that we live in, the ideal, or what the book says, is after every meal. That is usually we have 3 meals: breakfast, lunch, and dinner or supper. And you're supposed to brush after these meals. So as soon as you have your breakfast, brush your teeth.
But as a dentist, do you think that happens in Kenya?
That does not happen in Kenya because we cannot be able to carry our toothbrushes to our places of work. So what I usually tell my clients is as soon as you've had your lunch or your snack, try and gargle out, and what that does is it reduces the amount of food debris within the mouth, and the bacteria that is responsible for causing tooth decay has less to act on. Right, okay, and subsequently you do not have a lot of dental decay. In the evening after dinner, before you go to bed, brushing is the last thing you should do. So you don't go about your activities, brush, and then do some other things, take probably a glass of milk and then go to sleep. No, it is the last thing before you go.
So after brushing, you shouldn't take anything? You
shouldn't take anything. And the reason is the bacteria that are responsible for causing dental decay, that is are most active when we have reduced air circulation, and that happens to be during the night when your mouth is closed. So that is when they are most active. And given that the average person is sleeping about 6 hours, that is a long time for them to act on whatever you've left within the mouth, the sugars that are left within the mouth. So that is why usually in the morning people say I don't have fresh breath. It's because it's the action of this bacteria during the night. So that is where we should brush. That is the number of times you should brush. And each brushing session, that is in the morning or lunch hour for those who can, and in the evening, should last for at least 2 minutes of brushing your teeth. And how you're supposed to do it is do it in circles. Don't do the back.
Because I was coming to that. How do somebody? How are we supposed to brush our teeth?
How you're supposed to brush? The models that we use to display to demonstrate that, and how you're supposed to brush is the recommended is taking it in circles, not the back and forth. The back and forth, what it does is at the point where the tooth is getting into the gum, that is where the enamel is thinnest. All right, and what that does is over time it is worn off, and that results in sensitivity, gum recession, and all those adverse effects, those not so good effects. So you're supposed to take it in circles. So with your teeth together, take it in circles, take it in circles, take it in circles. Open up. Don't forget to brush the inner side, the inner side, and the upper side as well. You may want to angle your toothbrush so that you're able to clean nicely between those spaces. Don't forget to brush your tongue as well, because it also carries and harbors
the mouth odor.
It harbors debris as well.
Okay.
A light passing of your toothbrush, a soft toothbrush on your gums and on the palate for those who can without throwing up.
How about the dental floss? At what point should we be using the dental floss?
The dental floss should be used by everyone, and it is recommended because what it does is, if you do not floss your teeth, studies are showing that you're missing up to 33% of the teeth surfaces that you're supposed to be cleaning. That is a third, and that is a significant number. And you will find that besides the cavities that happen from the top of the tooth, the rest are usually in between the teeth where you're not able to brush, and that is where a floss is very important. Any of the mainstream brands of dental floss can be used, and they are waxed, they are thin, and they can be able to get in between the teeth. So you roll them up on your finger and pass them in between the teeth. The frequency of this at least should be at least twice a day for those who can.
Twice a day?
At least twice a day, in the morning and evening. Yeah, because that is where
the same way as brushing.
Yes.
How about tooth alignment? At what point should somebody be put? Okay, somebody use bracelets.
For braces, when they should be used or when they are indicated, there are various reasons why we do it. We do it to help this person bite properly. We do have patients who are born with things like cleft lip and palate, so there are deformities that are involved. There are the others we do for purely aesthetic reasons, that is for a nice smile. And when they should be done is teeth are usually supposed to be aligned in a nice U formation on both arches. Different people have this U varying in the way it is, but they should be aligned with no spaces in between them, and biting according to in a proper manner without clanging and not in the right places. So teeth alignment is done to ensure that teeth are biting in this manner. functional reasons, and at times for aesthetic reasons. The dentist will decide what type of braces treatment should be given, whether we are intervening to prevent a future problem, whether we are correcting a problem that is already there, or intercepting one that is already happening. Yeah, so that is the dentist will always decide.
Dr. As we're concluding, the month of October is the month of oral health. So what can you say about oral health, like in Kenya?
October is a really good month for health practitioners. Yes. We have breast cancer awareness. We now have our oral health month, and the situation in Kenya is dire. We've made very commendable steps towards improving our oral health care, and the biggest step that I think should be made is increased awareness to the masses. And this cannot happen in isolation of other events, and what needs to happen is the government should increase oral health funding to the Department of Oral Health and the Ministry of Health, so that they can enable them to pass across this message. We are seeing polio campaigns everywhere, cholera that recently affected us, safe birthing of mothers. So the same efforts that we are seeing in all these other fields, are the same efforts that should be put in oral health. Our budgetary allocation is below the 15% of the national budget as per their budget declaration, and that is what is going to health is less than 15% of the recommended. And you can imagine now, with the entire ministry receiving less than 15% of what is recommended, how much less is going to the to oral health issues. So that is what should be done. Like I said, our dentist population is very low. We have very few dentists, and if you are to go to specialists, then there are even fewer. So we don't have the skill set that is required in the right numbers. The skill set is there, but the right numbers are what is what is ailing us. So the government should look into training more dentists, giving an enabling environment for training of dentists here, and increased disease surveillance. Bodies like Kenya Bureau of Standards should ensure that the right levels of sugars are reduced in whatever Kenyans are taking, because we are now seeing that more and more foods and drinks are being packed in smaller packs to make them affordable to us. Here the sugar content is so high, okay, and they're being put at eye level in the supermarkets. So when you walk in, that's the first thing you see. And at eye level for the children.
The of chocolates are put on the counter.
Yeah, where there's the last thing as you're paying, let me have this chocolate and then put it. So regulation should look into this, and they will, in a cunning manner, put the small sodas at a lower eye level for our children to see. So, and they are shouting all over wanting and saying, I want this drink, this particular drink. And if you just flip it up and look at the sugar content, it's so high. So we are doing a disservice to our children, because they do not know what is right for them. It is up to us to ensure that we give them what is right for them, and so that when they come to a point of knowledge, they will say, I've grown up knowing that ABCD is not so good, and they will perpetuate these habits to future generations.
Maybe somebody somewhere is watching us, and he or she is wondering, how can I reach or contact Tim Theuri? maybe for dentistry, maybe checkups and the likes.
All right. For those within Nairobi, I am in Kimani. Smile and Crowns is the practice that I run, and I'm on Wee Plaza, and that's on Galera Road. So that's where they can reach me. Do
you have a website, or like in social media? Do you have a page?
Yes, on social media, we're on Facebook and Instagram. Yeah, that is the age where we are living in.
We'll put them on the scrolling.
Yeah, fantastic.
Tim, thank you very much for coming and gracing us.
Thank you for having me. We hope the message is clear to our people, and I'm happy to come again and clear things questions that you may get.
I know there are a lot of questions. Thank you very much. And with that marks the end of our show. Thank you very much for watching. My name is Sharon Ong'awo.